Hi, I'm Suneel Chilukuri, board-certified dermatologist from Houston, Texas, and I'm excited to share what we just presented on at the 2026 Maui Derm here in Maui, Hawaii. What we're talking about is what's trending in 2026. What do we see at the end of 2025? What's coming down the pipeline? And two of the things that I'm most often asked about is, number one, what are we doing with our GLP-1 patients? And number two, what are we doing with those estrogen changes that occur for the skin? And they go hand in hand, which is very interesting. With GLP-1s, it's just a craze, and it's not now just national. We're finding this internationally as well. So I'm about to present in Korea and in Germany, and both places asked, what are we doing in the US to combat what we call Ozempic face or Ozempic body? So it's really interesting. The thing that we're finding with these GLPs, it's very different than typical weight loss. It's not that you have 70% of your weight loss is coming from the fat and 30% from muscle. It's the opposite. We're finding that there's 70-ish% that's lost of volume or weight from the muscle. So what we find is that, especially in the face, in those areas with thicker muscles like the temporalis muscle, which is both estrogen dependent as well as insulin dependent, we find there's a massive devolumization or deflation that's going inside there. So pay attention to that for your patients. The second thing that we're seeing with the GLP-1s is lack of protein and proper nutrition. People are finding this the easiest diet that they've ever seen because they're just not hungry. They don't drink as much either. So what's happening at the beginning, everybody feels great. They actually have more energy after a period of time. But the problem that's happening internally is we're having greater breakdown of your collagen and elastin without the regeneration that we typically see with those who are healthy, especially with the nutritional aspect. What do we do to combat this? As soon as I find out that one of our patients is on a GLP, I start asking them at the 2 to 2.5 month mark, how much weight have you actually lost on the scale? And when we see there's a 7 to 10 pound weight loss, this is the time when we talk about using either a biostimulatory agent or a bioregenerative agent, especially for the head and neck area. So that can be something like a PLLA, it can be a calcium hydroxyapatite, it can be fat. Especially when you have somebody who has a little bit of excess fat, you can harvest that fat in small areas. This is very safe for us to do in a dermatology space, and then re-inject it along that subzygomatic area in the temple, even along the neck, and we can have wonderful regenerative properties that are there. We also have something that are called bioregenerative mechanisms. So that's not just fat, but that's where we can take the blood, we spin it down. And for those of you who are watching, you say, I already know what PRP is. That's not that exciting. This is PRFM, but it's in a gel format. So platelet-rich fibrin matrix, which we know creates a little matrix that in theory is supposed to stay there for about 7 days, and we have the platelets aggregate along with the growth factors. In real life, we found that that lasts for about 5 days of that effect. What we find now is we can use, I call it an easy bake oven. So we put that blood, we can put it into this little easy bake oven, into these 1 cc syringes. You lay it upright, and then you allow it to sit. What ends up happening as you slowly warm that, it creates a gel. The gel is just like an HA that you can inject. But the advantage of this versus an HA, it's not filling a space, it's literally an on switch. So if we're using it on the face, we're using it in that periocular area. It's a tremendous tool that we're finding. And there's 3 major brands that are out there. And if you reach out to me offline, I'm happy to share with you what the data shows, which one is the only company that's actually doing research in that space right now. So that's why we talk about the GLPs. What else can we do? Of course, we can put structural filler that's inside there. So we're talking about the temples, mainly the lateral aspect of the subzygomatic area, and we can do things of that sort for the structural change that occurs with the GLP changes. There's also a change that occurs with estrogen, both with maturity as well as with the GLPs. And with that, we're having many consumers ask us, should we be using an estrogen topical on our face? And there has been 0 research that's there that shows anything. Currently, there's about 7 publications that are out there. Only one shows that there may be a little change in the corneometer, and only one that shows maybe there's a little bit of difference in terms of the structure of the skin itself, but none of them are biopsy-proven studies. So where do we put the estrogen? Put it either topically or on the mucosal surface. That can be on the vaginal mucosa, or you're going to put on the inner arm, or you can do a little patch. Also, we understand that oral replacement of the estrogen as well as progesterone can make the internal aspect change, improve, and we find that it improves your overall skin. Since we talk about both GLP-1s and estrogen, a publication that was just released this morning shows that those patients who are on hormone replacement therapy and also on a GLP, they find greater weight loss, and it seems to be a healthier weight loss. So it's not just the muscle that's being lost, but there's actually a change in terms of that composition. So more fat is being lost than muscle. So I just want you to share that with your patients. Hopefully this is something that's useful. Reach out to me anytime. Again, I'm Suneel Chilukuri, board certified dermatologist in Houston. I look forward to seeing you in person.